The biggest problem in healthcare is access to quality healthcare. How do you empower an 85-year-old to be able to go to all their doctor's appointments, to go to rehab 2 to 3 times a week in a large hospital system where they have to walk thousands and thousands of feet, literally, and manage and navigate a very complicated, old, oftentimes, building that has been revamped however many thousands of times, and new systems being built on top of old, and now they have to manage a kiosk instead of handling a person in a parking booth, and all these changes all the time, right? And then having the time, the energy, and the help, sometimes if necessary, the ability to have someone to help drive you there if needed, or you driving yourself. There's a lot of difficulty and complexity when you look at older people or people with certain medical diagnoses or certain cognitive impairments. It was an event every single time because the amount of energy it took, the amount of time it took. And if we think about how long it might take for you and I to get there, how long would it take for someone with a neurological diagnosis, someone who's having to utilize a walker or doesn't have the energy that they did 5 or 10 years ago? How can they manage that? Managing an entire hospital system as part of your daily life on a regular basis, not to mention the energy and everything else. Managing how are you going to get there? Would they get the type of care that they need when they got to the large hospital system, or would they get kicked out and discharged by Medicare or whatever insurance company that dictates that, you're not going to be able to achieve as much, quote unquote, functional progress is the term that's used. So because there's not enough fast progress, we're going to have to just discharge you after, 5 or 6 visits, when you might have an 85-year-old person who wants to get back to doing things in their life that they haven't done in a long time, but they are motivated. They know they can. They want to be able to go for walks with their grandchildren. They want to be able to dance at weddings. They want to be able to get out on the boat and go fishing again. And why not? And why not provide that level of service to them on their terms in a way that they call the shots? And here's the part that clinicians can grasp even more. It's the home is the best place to do the rehab because that's their home environment. So a lot of what we do let's say neurological specialists or in inpatient rehab or in skilled nursing is how do we get them home safely? The vast majority of the work is how do we get them to get into their home, to be able to move in their home, how to get them to the toilet, and then to be able to stand up again and be able to get back to the bed or back to the chair. How are they going to take a shower? How are they going to manage the carpet?
Yeah. The basic functions of their home, navigating their own home.
Right. So can we cut a lot of that out and just get to them in the comfort and safety of their own home? I've seen people discharged out of the hospital. This will blow your mind.
I know where this is.
They had to be helped by large men into the car out of the hospital after a leg fracture, but that did not require surgery, that just needed to be healed. And they were not given any sort of assistance or thought to how are they going to get back into their house or back into the car once they leave the hospital.
Was that their concern, I suppose? Right?
And then another client, pubic fracture, again, doesn't require surgery. It's painful and there's a lot of problems with it. It required the fire department to lift her into her bed after getting discharged out of the hospital. So they had to call the fire department to bring her up and lift her into her bed after she got discharged out of the hospital after a pubic fracture at 85 years old. So people are being discharged out of the hospital that way, right? So how do we, again, access to quality healthcare? It's an access problem. Or these types of mistakes are being made. How do we fill the gap?
How do we address that?
How do we address that? how do we then get the person into the home as quickly as possible? Because it's going to take home health a while to get to that person. How can we get there quickly?